Okay, go and look how to make image-based question. Image-based question are basically of three types. First is the identify, solve. Second is understand, identify and solve. And third is identify, recall and solve. Now, you have to understand that in each of these three types, identification of the image is of critical importance. So, if you're not able to identify the image, you will not be able to solve the question. So that is the base of the image based question. Let's look at first type, that is identify and solve. In this type of question, if you're not able to identify, you're not able to solve it. Simply just by identifying, you are able to solve the question. So there is no reasoning involved, there is no recall of information involved. Simply you identify or you don't identify. Something like, identify the instrument shown in the image. So if you know it's a skin stapler, you will be able to write it. Otherwise, you will not be able to solve the question. So identify is solve this. If you are able to identify it, you are able to solve it. The second kind of example would be, the following characteristic finding is suggestive of which kind of poisoning. Now, if you are not able to identify these blue lines, you will not be able to tell which kind of poisoning it is. So the moment you identify it, the answer is written on the diagram itself. It's kind of that. So identify, solve questions are, if you are able to identify it, you are able to solve the question. The second is identify, recall and solve. In this, it starts with identification of the image, but it's not a very direct question. Once you make in the identity, you will have to recall some theory aspect of that particular image and then solve the question. Like say in this question, a patient presented with the following type of cataract shown in the image. What is the most probable diagnosis? Now you see this image, and if you don't identify that it is a sunflower cataract, you will not be able to even think what kind of answer should I give. So the first step is identifying that this is a sunflower cataract, and then recalling for the causes of sunflower cataract, and then finding the answer. So identify, recall and solve. Let's look at another example. Identify the use of the below instrument. So first you should be able to identify what is this instrument. This is an anoscope. So, and for what it is used. Then you can tell, okay, it's used for this particular purpose. Let's look at another example. Which of the following is true about poisoning by the snake shown in the image? Again, if you're not able to identify the snake, forget about the poison. So once you are able to identify, then only you will be able to tell what kind of poisoning does the snake bring. So identify, then recall. So identification is the first step, but the question is not directly based on the identification. You have to recall some theoretical information about that particular image and then solve the question. Similar, identify the following instrument is used for. So you have to know what this instrument is before even answering the question. And important part is that even if you are able to identify the instrument, but if you are not knowing the theory information behind that, you will not be able to solve it. So it's a level higher than what is generally identify, solve questions. Similarly, look at this. The patient presented with the following picture on examination of a tongue. Which of the following is true about the pathology of the disease? So first, based on the image, you have to identify the disease and then think of the pathology. So again, it's an identify, recall and solve type of question. Now, the last type of question is understand, identify and solve. Now in this, the typical, if you have seen the earlier question, if you could not have identified the image, you could not have solved the question. But in this, there is some kind of information given in the text itself. So if you understand the text and then you are able to identify the image, then you will be able to solve it. But identification of image is not that critical in such kind of cases. It just helps. So a patient presented with nausea, vomiting, abdominal pain and diarrhea. His urine sample is below. What is the most probable diagnosis? So you know that he is suffering from some kind of poisoning, and any poisoning in which the urine is green color, probably it's copper sulfate poisoning. So you understand. So there is a lot of pointers in the image itself, in the text itself. You see at the image, then you try to correlate both, and then you are able to answer. Similarly, a middle-aged man presented with paresthesia of hand and feet. On examination, his hand was seen like this. The most probable diagnosis. So again, paresthesia, what kind of it is, you will be able to. So you have a clinical case, you have an image, you correlate both of this, and then you come to the so this is understand, identify, and solve. But the most critical aspect of any image based question is that it should be, there should be, without the understanding of the image, without the identification of the image, there should be very less likely that the student should be able to answer it. So it can be a very direct question, just identification of the image, or it can involve where after identifying the image, the student has to think of some theory behind that image.